So there are interactions that you have in life with people that are somewhat random, somewhat, um, how do you say, synchronous. And this is one of those conversations that we're going to have today with Suz Vera Burroughs, who is the owner of Unwind Oakland, correct?
Yes, I'm
Yeah.
at Unwind Oakland and Unwind Learning.
So I was in a meeting with you, a breakout room in a networking group that we're in, and I was so fascinated by the conversation that we were having that you and I had a follow-up conversation after, and it turned into, I need to talk about these things on this show, and it was absolutely beautiful. So, Suz, can you introduce yourself and just tell me a little bit about like how you got into the work that you do, and let's talk about the work that you do first.
Okay. So I am a board certified massage therapist and approved continuing education provider. I have a master's of science in education. I actually used to work in tech. I did a lot of transformational learning for adult learners and online learning. And I was the first to develop and gain a national certification approval for 1 hour of ethics CEs. And it's on the topic of psychedelic and entheogenic conversations for massage therapists. You know, somebody comes into your office, they just saw a documentary on Netflix and they want to ask you about psilocybin. What are you supposed to say? How do you protect your business and stay in scope of practice, but also have a compassionate and informed answer? And so that was great. I also have really been working a lot on post-psychedelic integration massage. So what does it mean for massage therapists to be working in that space? What's the sort of things that massage therapists need to be aware of? And I've also bridged ketamine-assisted work with massage therapy and do a ketamine-assisted therapeutic massage where I'm collaborating with medical professionals and I support clients. Often they're coming in with a combination of complex pain and trauma. So, and then I also do a lot of advocacy work. I was actively contributing to California Senate Bill 1012, which unfortunately did not make it out of appropriations, but I really was there to ensure inclusive facilitator access to licensing as well as Indigenous autonomy.
You have done so many cool things. I remember like when we were talking a couple of weeks ago and you were sharing some of the stuff, I was just like blown away. And one of the things I thought that was the most intriguing, one, we know that just anybody who's done any of the work in medicine, it's taxing. Like it's like really taxing on your body, but we don't ever think about adding massage therapy or clinical hydration or anything. We talk about the neuroplasticity side of things, but again, from a massage therapist perspective, this is really vital work. I mean, really.
It is. It is. I know one of the things that we had talked about was, one of the reasons that people come in for post-psychedelic integration massage and why it's offered within retreat centers and in Indigenous or lineage practices after ceremony is, it's multifold. One is there's a body load that has been activated, and that can be from metabolizing substances. It can be from physical catharsis, shaking, trembling, muscle cramping, and things that come up as the body is unwinding these embodied patterns and as the medicine is affecting the body. I don't consider those adverse events. I know that they're considered adverse events in some measures. I think that the physical catharsis is wonderful, but it can be exhausting. And then there's also what I'm finding is the release of specific holding patterns. When a muscle or a fascial tensional pattern has been held for a really, really long time, and suddenly it's being released and that muscle is able to move again, that represents a really new metabolic load. And so there can be a lot of sensation and processing, both physiological and emotional, that are associated with that. And so we were kind of talking about like, oh, isn't this interesting that, you know, there is a health and safety screening, often within medicine experiences or ideally. And when there's body work involved, are we also thinking about things like the liver, kidney, and circulatory loads that massage therapy does put on the body in combination with load that might also be there from metabolizing the whole of a experience of an altered state of consciousness?
So we were just kind of talking about this beforehand. So I was in a ceremony last weekend, and it was just incredible, like life changing stuff. And I watched how the body from everyone in ceremony, just because we had all really such a beautiful experience of sharing everyone's load. Like we were sharing, and I was like kind of equated to bearing each other's burdens, like because you feel the laughter and you feel the pain and the trauma, and you feel really all of this. And it was so interesting how the room itself just kind of like ebbed and flowed with the energy of everyone. So I can totally see that because, you always see people who are stressed and, like we either carry our shoulders a certain way or we carry our backs. Then when you're able to release this tension, whether that be through medicine, whether that just be everyday life, I can see how that would be like a completely new situation that you would need to kind of work through and get everything done. I remember as an ultra runner, that was like the very first thing I would do after getting done is you want to move the blood, you want to move everything through the legs and through the rest of the body.
Yeah, and a lot of the technique that I use with people who have had really physically demanding journeys is the same kind of technique I would use with somebody who's just run a marathon. Yeah, so they
Hmm.
are quite related. Yeah.
It's almost like the mental marathon is kind of how I always equated it. So yeah, the other thing that I thought was very interesting when we were talking too is we were talking about ketamine and massage therapy at the same time. Um, that's something that I've never heard of. It's something that I know a lot of people may wonder what that is. And I was really fascinated. And I'd actually mentioned to a couple people, they're like, yeah, I've heard of that. It's like absolutely amazing. So tell me a little bit about that and how that works.
So I consider myself somebody who sits on the bridge between massage therapy and ketamine assisted psychotherapy. And I think that the first thing to know is, I have a very careful practice where I'm working with prescribers. We have documented collaborative care. We're going through a really solid 5-phase process, good, ketamine practice. And also that, there is a bidirectional relationship between things like chronic pain and a lot of things that we're using ketamine for within the psychotherapeutic realm, like PTSD symptoms or management or treatment resistant depression. These have a relationship with chronic pain. And yet, the ketamine experience is so designed around a model where you're sort of stuck in a chair and not able to work with the body very much, even with low dose ketamine, um, where that might be a little bit safer. So, in my own experience with ketamine and Spravato treatment, I really wrestled with that. And I always go on the ground rather in the chair so that I can move. And it really helped me unwind the chronic pain that I was having, which was a nociplastic pain, a pain that was from the habit of feeling pain rather than from tissue that remained unhealed. So I was having this tremendous experience, and I wanted to bring that to clients. And in doing so, really learned a lot about the biopsychosocial pain model, which is a much more up to date pain model than most people work with today, but also that there are so few spaces where you actually get to work holistically on biopsychosocial pain. We kind of have this Cartesian, reductionist, siloed hangover within our care systems. And it's very difficult for a psychotherapist for a lot of different reasons to work on the anatomical, physiological aspects that I work on. So how do we stay in scope of practice and collaborate openly is a really difficult question. And, ketamine massage within underground has been happening for decades. I discovered after I started trying to do this work. And so I don't consider myself a progenitor, but certainly doing it above ground is like a whole other can of nuts.
Yeah, so talk to me about that. It really is because you're doing this above ground and no one's heard of it. I mean, I didn't even know it was underground. So that's really why I was so fascinated by this conversation. And
Well, I think that the first thing is, I work with prescribers the same way that I work with any other specialty. And, somebody can certainly, if they're on Xanax, they could take a Xanax before a massage. I would love for them to disclose that information to me. Certainly in pain management, there's an overlap of working with other scheduled substances like opioid and medical massage. So, but this to me is, if I'm working with somebody who's in active cancer treatment, there's documentation that I need from their oncologist to make sure that I'm working in that person's best interest or at least not causing harm. So that's the same kind of documentation that I require. So nobody can just walk into my office and bring a bag of ketamine and jump on my table. That's not what is happening. If you do that, maybe you're at Burning Man. That is your choice. Professionally, I do not recommend it. But what that means for me too is that I've done preview massages. So nothing happens in my office with ketamine that hasn't happened without it. And that's really important for me. So we have built therapeutic alliance. Obviously as a massage therapist, my capacity for touch contracting and touch attunement is extremely high. And so there's a lot that goes into that. There's a lot of informed consents, which I've had legally reviewed by psychedelic lawyers. It's been a big investment. And honestly, when people hear about what I do, there's one of two responses. Either people are so excited and they're like, that sounds awesome. Heck yeah. Or they're like telling me horror stories and I have their shadow kind of flying in my direction. And it's a really difficult time to be having this conversation. I know I just had the Touch with Substance conference that I hosted in October. And, that was right after the FDA's decision around MDMA, which has opened a lot of old wounds around touch practices within psychedelic spaces. A lot of people's life's work has been delayed. And then they hear what I do and they're like, oh, let me just throw all those feelings onto you. And I have to be like, no, thanks. That's not what I do in my office.
yeah,
And Matthew Perry's death obviously has kicked up a lot of conversation around ketamine and responsible use of ketamine. And again, those doses, that kind of practice is not what I do in my office. So I think that there's a lot of education around this because it is new, and yet it is so paradoxical. And what people imagine happens with massage and ketamine in practice is so different. And that's the other thing that I love talking about too, is that, we imagine like, oh, well, what about the dissociative effects? And if somebody needs deep tissue, and it turns out at low dose, we're really working with profound association rather than dissociation. And the whole fascial system is so de-armored, just like the emotional system is de-armored with ketamine, that deep tissue is not even a technique that needs to be applied because everything is warm and you can go straight to the anatomy that you need to access, which is amazing. And then the body becomes this storyteller where the anxiety and fear around whatever has been stored in the body is able to be heard. And so I have people who have been stuffing pain, resentment, PTSD symptoms into their body. And we go into this, sacred topography of their scar tissue. And suddenly they can process what happened at
wow,
that location and how scary it was because they were hanging on literally for dear life in an emergency surgery situation. And like, now I can turn toward that pain, um, and really look at it with some softness and compassion and process what happened. So that kind of stuff is coming up where, and so the other thing that I do within collaborative care is I'm not a psychotherapist. I don't pretend to be one, and I'm very clear about that in my documentation. But I want to make sure that people have an opportunity for integration within an appropriate container for that. And what I've developed is something I call anchoring. So, one of the things about the ketamine experience is that a lot of the insights float away very quickly. And it's interesting with touch, they actually stay anchored in the body. People seem to remember them more, but still, I want to help somebody take meaningful notes. Again, I call them anchors, little keywords and things like that, maybe specific locations or stories that were coming up that they can then take those notes into a talk-based integration container. And I think that that's been really powerful as well. I'm careful not to have them over verbalize and over cement whatever they feel might be going on. I want to make sure that there's room for unfolding while at the same time maybe giving them a body map and some markers, some different colors, and like that they can draw a picture of their experience that they can then, take into their therapist office and have a deeper conversation about what was coming up.
That's really very interesting. I remember I was talking to someone. I'd gotten a call, and they had an autistic son who had gotten into a candy bar, and they had been opening up all these things, and he was trying to figure out, how do I talk to my son about the experience that he had when he got into this accidentally in a psilocybin candy bar. And I said, why don't you get out markers and some paper and have him draw? So, that is such an interesting concept, to be able to just take the body map and to be able to have different markers. I wanted to go back to a couple of things, because I think we have this tendency in our mind to think, oh, okay, massage therapy, ketamine, I'm coming in with either a gigantic bag of something, or you're going to be handing me a giant bag and we're just going to trip out and it's going to be amazing. That doesn't sound like that at all. So kind of walk me through that process. Like, I decide, hey, I want to go to unwind. Like, what does
Okay.
that process look like?
Mhm.
Because there's a lot of informed
Sure.
consent. And as you were saying that, I was thinking about that too, because there are two schools. There are the, hey, this is what we're doing. I love that avenue because I feel like people will gravitate to that. Then there's the other side, which is the shadow you're getting pushed on. But I feel like it's just that's going to be that way in everything almost. So kind of walk me through that process. Like, I decide I want to do this. How does that work?
Yeah. Well, there's the ideal process, and then there's what happens in reality. So, the idealized process, the way it's designed, is that somebody has worked with me, um, or they're coming to work with me. They're thinking about ketamine-assisted therapeutic massage. It is not something you can just book off on my menu. That first of all, you can't do that.
So
But
I
you
can't
come
just
to me,
say I'm taking my bag of pills or my special K or
no,
whatever we want to call it, and just call Susan and she's gonna hook me up.
not interested. And that for me is actually a really good filter for the clients that are not for me. I keep Narcan in my office. I'm trained to use it, but if I have to, I've made a series of terrible decisions. And so I'm very careful about that. I'm also very careful about not wanting to get caught up in diversion schemes. One of the things that I think is important to recognize is that massage therapy is not regulated as a healthcare benefit. It's regulated as a law enforcement problem. So this is not the space to get cute
Right.
at all. So to that end, somebody comes to me, we're first going to establish relationship. I need to know what's going on in your body. I want you to feel safe with me. And again, to know nothing that would happen with ketamine hasn't already happened in a sober session. And so I'm really assessing everything from range of motion. A range of motion might suddenly feel really good in ketamine, but still be a really bad idea for your body. I need to know those things. I also need to know, what are you working with? What are your expectations? Are they realistic? Are you naive to ketamine, or are you in current ketamine treatment? because there are some, dose finding that I'm going to do with my collaborating prescribing partnership with the case. So those things are all groundwork that we are doing together in this really, beautiful dance of nonverbal and a lot of paperwork communication. If we decide that there's a good reason to do it, knowing that, with ketamine and we're talking about prescribing, which means we're talking about diagnoses and we're talking about pathologizing. Not all of my clients are diagnostic and pathologizing. Some come just for pleasure, but that's not what KATM is for, because it does require a prescription. So, you go through that process, working with the prescriber. I will often talk to the prescriber about the case. We'll talk about goals, outcomes, appropriate dosing, get that all documented to me directly so that it can't be altered by a client. So I have dosing orders, and, depending on the situation, a physician might need to be present on site during administration, which is something that we always have to consider. And then, when we get to the actual session, I'm doing a lot of checklists. What is your transportation plan? Did you follow your doctor's orders? And just a lot of things like that. So, and then I always give home care tips to all of my clients, things for them to explore. It could be a yoga pose, different things like techniques for home massage on a problem area, and then the anchors that are going to go back to the other collaborators within the care team. I think in reality, we are in a high anxiety culture around touch, and we are in a low touch culture. Touch deprivation is a serious issue with long-term behavioral and health outcomes. And what ends up happening, when you're having a new protocol and a new process, there's a lot of questions and confusion. And so there's a lot of communication that has to happen with prescribers. But then also our culture, particularly within the psychedelic space and within psychotherapy, has a lot of decision making right now is happening based around fear of touch. And, that's hard because it is, how do you cure touch deprivation?
Right.
So, sometimes that might look like, okay, well, let's start off then with post-psychedelic massage therapy after your ketamine experience. And how do we back to back that? Or how do we work within your critical window period rather than working with the ketamine and the massage directly? Because a lot of prescribers do not want to sign that paperwork. And it can be fear. It can be how their liability insurance is written. I've had prescribers say no because their liability insurance is written only for their office location. And so it becomes incredibly complicated to implement in terms of like business operations, as well as culture. And that's tough. I would love to have a full clinical calendar only doing ketamine massage. But the reality is that this is new, it's going slow. And that's probably a good thing, because it means that we are taking time to answer all the questions that need to be answered. And it's also incredibly frustrating. I know I'm writing a book right now called Beginner's Body on ketamine massage. And we follow a case study in 6 parts throughout the book. And, the first part of the case study is trying to work together to get a prescriber who would say yes for somebody who was already in ketamine treatment. So for her to work with me, she had to go to multiple prescribers to try to get a yes. She had to ultimately break her therapeutic relationship with her previous ketamine provider.
Mhm.
So her, I don't like that at all.
Right.
And this was like her decision. I was like, we were continuing to work together with doing integration massage, but she was really like And the quote I have from her is, it's like they don't trust me to know my own body. So there was really this issue not only of understanding what I do, understanding my process for ketamine massage, understanding scope of practice and the care taken, but also understanding what the client is saying, the patient is saying, and how many people come to psychedelic work because they have a disintegration issue between their psyche and their lived embodied experience. Like, that's an incredibly common reason to come. And yet fear of touch is permeating these containers, and it's doing it in a way that is not of service to the people who are coming. I feel like we talk a lot about fear, and I certainly don't care to silence anybody who's experienced harm and touch harm within or without a psychedelic container, above, below ground, stolen ground, wherever. However, we're telling stories for shock value and co-opting stories of harm
Right.
so that we can take power out of the hands of the people who have been in these spaces for decades, centuries, millennia, and place it in the hands of institutional power and capital power that has the least experience. So I always have to question, when I hear the fear and the stories of harm, why am I being told this story? And, there was a recent study that came out that I have a lot of issues with the science and design on. And so it's like really looking at that with some media literacy and science literacy, and trying to say, well, what if we had a conversation about what worked? What if we had a conversation about discernment? What if we had a conversation about red flags, yellow flags, green flags? What if we talked to the touch practitioners before creating touch rules in Oregon and Colorado? What would that even be like? And that's a tough conversation for people to have. And I think I'm going to be knocking on those doors for a really long time.
No, it's so funny because I always think the same thing whenever I hear anyone talk. Who is saying what and why are they saying it? And we don't have a tendency to ask ourselves those questions. Like we tend to run to whatever the loudest noise is. And I was a political science major in college, so I always loved politics. And I was one of my favorite books, even today, is the Federalist Papers. And our founding fathers knew that that the minority, I mean, the majority could be swayed any direction they wanted. They called it the tyranny of the masses, because you just had to tell them whatever they needed, because they're not going to go do any fact check. So they're going to trust whatever anyone says. And you're kind of seeing that. So you kind of talked about the MDMA and the whole Lycos AdCom thing. And then right after that, you hear all of these stories of, somebody harming themselves in psychedelics, or so you're kind of hearing this narrative that someone is pushing somewhere, and you kind of have to go back and just say, stop. Like, can we look at this a different direction? And I love that. So, and I don't think we think about those kind of studies of why we should.
Yeah. And we often don't listen to the stories of people and their lived experiences with positive conversations
Yeah.
around how they've been supported with touch, in a lot of different kinds of containers, with or without altered states of consciousness. But one of the things that I have learned, I'm somebody who is neurodiverse, complex PTSD, developmental PTSD. I am an assault survivor. I work in a touch practice where I'm in my shadow every single day in a beautiful way. And that also, I think, allows me to have a different perspective on touch. And for me, a lot of my healing is recognizing that healing is not the absence of the suffering or the pain of things that I've experienced, but it's the presence of something else. So the idea that when somebody is ready within their journey to start repairing their relationship to touch, the only way to do that is with touch, with ethical touch, with attuned touch, with specific touch that moves at the speed of trust, But the idea that now in my life, I can hug people
Mm.
who have a similar background and age to people who have deeply harmed me, and I can really enjoy that hug, it doesn't erase the harm, but it allows for more things in my life. And that is something that I really want to be for. And yet it's also difficult. I think there's a lot of confirmation bias and there's a lot of pain, and we see it acted out in our culture in really sad ways that I really have a lot of feeling around. And yet I can bring somebody into my office, put a warm towel across their collarbones, ask them to open their heart space, just ask, how does it feel? Does this feel safe? And for them to say, this is the first time somebody has touched me anywhere on the front of my body in 30 years. It's like, hey, like, we can hold this as true and safe. That's great. Like, I'm for that.
Yeah, I'm an abuse survivor as well, and I don't think I really ever forgave my parents, my dad especially. And I had ceremony this last weekend. I kept seeing things over the last couple of years, just a forgiveness, resentment toward my dad. Um, and I'm going a little slow here, so I'm trying to put this into words. So Monday morning, I was just thinking about all of the things that I had seen in my 6 hours, and I decided to call my dad. Um, I'm 55 years old. I don't have those conversations with my dad, with really just anyone. And I called him up. I left him a voicemail. He called me back, and I said, "Hey, how were you when you were 3?" Because I think I'd seen him in my experience, and I had his pack. I had a bag of whatever my trauma, and then he handed me his trauma, and I'm kind of walking around with all of the stuff. And then I knelt down to pick him up. And to tell him it was going to be okay. And then it was me. Like he and I are one. Like I've tried my whole life to not be him, but I was. And we just had the most beautiful conversation. And we were talking about how all he wanted was to love me. And I told him that I was incapable because I was abused at 5, like everything from 5 beyond. And now just being able to let go of all of that. I love hugging now, and it's cool. But I also see the other side of people being so held by that fear. I think of a couple of people I have, men I've hugged over the years who have sent me messages. It's like, dude, that was like the first time I've ever felt loved, and it was weird. Like, because like you hug them and you're like, dude, like you feel it. So it's such a conflicting thing because you hear all of the focus on the negativity side of that. But when you really let your heart open and heal, it can come from such a different place. And I'm not saying, again, like you, be tuned, discern, know where it's coming from. But when you open yourself to that, it's where real healing begins.
And to understand the context too, that um, we're in a culture where we really conflate um, touch with some very specific things, and to uncouple touch and to have platonic intimacy is really a growing edge in our culture. And a lot of the touch issues that we see clinically in the United States, they don't see in other countries, or they're quite different. So, when somebody is able to open to that, it is a really tremendous gift. And one of the things that I teach ethical safety and support touch for non-massage therapists, for people who don't do what I do. And one of the things is within touch contracting and within a lot of the rules for the above ground, psilocybin centers, you really can't give somebody a hug. And one of the things that we teach is a yes can become a no, but a no cannot become a yes. So as we're talking about touch, and it can be a one page, like have the preview conversation about touch. Most professional organizations that deal with trauma don't even mention touch in their professional guidance at all. That's like how shadowed it is. Sabrina Santa Clara is an amazing psychotherapist who talks a lot about that. But if there's somebody who, we've agreed this is our touch contract, there's not going to be hugging, that's not something you're comfortable with sober. And then in the middle of their experience, they're like, actually really want a hug right now. I actually feel this tremendous openness, that pathway that was denying me access to enjoying this or receiving it without fear or worry is like, I want a hug. What do you do with that person? Because a no cannot become a yes.
Right.
And so there's a couple things that I would offer to practitioners or even, friends, whoever. The first thing is to stall, because you're going to need some time to think. So in your stalling, it is all about, where do you feel that in your body? Tell me more about the feeling that you're having. Let's sit with this feeling for a minute before we do anything else and really celebrate it. Right? So having that moment of celebration will give you a little moment to think. And you might have, like, I'm wearing this cozy wrap that my grandmother made. She was fantastic seamstress. I might be like, okay, I'm going to take this thing I'm wearing, or I might have a throw blanket or something else in the room that I can wrap around the person. And I'm going to say, look, I'm going to honor our agreement. First of all, you're telling somebody, this is what somebody who is safe and respects your boundaries acts like and feels like. So now you're giving them that gift by honoring your boundaries that you set before the session, but wrapping something around them. And then in my body, I cannot lean over somebody and I cannot hold a hug for a long time. What if that person needs 20 minutes of hugging? That's weird, man. That's weird for me. And I'm going to transmit my feeling of weirdness to them, right? I don't want to transmit discomfort to them. That's not the goal. They're hypersensitive to everything I'm feeling in that container, right?
Mm-hmm.
So what I want to do is something that feels comfortable for me in terms of my own boundaries, protect myself as a practitioner, but also in my body mechanics. So what I like to do is, if we're sitting, I will sit on my sit bones and I'll just lean my arms back. So I'm not using my upper body. I'm just leaning back into the tripod of my sits bones and my tailbone. And I'm letting my spine come up and I'm letting my arms be long. And if I feel like maybe I want a little gentle sway with the music, I might transmit a little movement through that piece of fabric. And that helps them feel all that subtle movement and nuance of human connection, because we are gibbly moving, kinds of creatures. We're not static. So now we have this thing that I can just hang on. My biceps are not really engaged. I might open up my chest, drop my shoulders, get really cozy with it. And then I'm offering them recognition, celebration, boundaries, connection. They can lean back into it and really feel supported, right? And ask, how does it feel to have somebody have your back? Even though I'm sitting in front of them, right? How does it feel to have somebody have your back? Where do you feel that in your body? And so there are absolutely these things that we can do. And yet, if we look at something like the Colorado DORA instructional objectives for their relational and touch module, which is 10 hours, 90% of it is fear-based harm reduction. And not a lot of it is, well, what do you do? Like, what are the tools? Giving somebody a warm bag of flax, like a 5-pound bag of flaxseed that they can put on their chest and say, I'm going to honor my boundaries, but I want to give this to you as a representation of what my hug would feel like right now. And because it's there, maybe you can put your hand on the other side of an object especially if it's thicker, maybe you can sit side by side with the person and say, you know what? We didn't agree on hugs, but I said I would sit next to you if you ever needed it. I do that now. And if you want me to move away, that's okay. We'll see how it feels. And if it doesn't feel good, I'm going to understand. So there's a lot of different things we could be doing. And we need to have spaces where it's okay to have the conversation in order for those skills to be transmitted. And it's not just like, here's step one, step two. It's really transmitting the vibe, which is,
As you were saying that was thing, I was kind of thinking that, like, how do you teach the vibe? Like, okay, here, throw this flaxseed on you. Because to me, this all sounds so, the word that comes to mind is safe. Like, it just sounds, it's beautiful, but it's safe. How do you do that? How do you teach the vibe?
yeah. So I think really the word that comes to mind for me is attunement. So one of the things that is very difficult, new massage therapists is like you're doing the reps and the practice in massage school and you're building a sense of attunement. And that's attunement to anatomy. It's attunement to what's going on in your client. And here's the secret sauce. And you're not going to believe this, but 80% of attunement is paying attention to what's happening in your body and knowing that you
Right.
cannot touch without being touched. So one of the things that I do as an exercise for attunement is we pretend we're a mama otter, a sea otter. So I'm here in California. I grew up going to Monterey. I love sea otters. So we pretend that we're a sea otter and we're floating, right? We're noticing the floating. We're holding the baby sea otter. There's that level of care and attention and adorableness that we can hold. And then I like to tie the little baby otter up in the sea kelp, which is something that otter moms do. And then with that level of care, drop those hands down onto your own legs, just the tops of your thighs or your knees, and see if you can offer yourself that level of care and attunement. So that's like one place to start, is to start with attuning to yourself. Now you might be noticing, hey, like if I use the gentlest pressure possible, maybe the pressure of the feeling of a nickel or a quarter per finger, what do I notice about how my leg is moving? And you might start to notice things like, oh, actually my thumb is kind of on the inside and I can start to feel my pulse. Isn't that interesting? Now take that skill to a client and it might be, you're pressing their feet because they're not feeling grounded, right? So you're giving their feet some pressure. And it might be that you're paying attention to what is the subtle movement. You have to become that sea kelp. You have to become soft. You have to be back in the backside of your body and stable in the tripods of your own body. 80% of the attention. If you find yourself leaning forward into the client's body, you're coming into their space in a way that's not sustainable in your body and is imposing. So it's like, okay, can I come back? Can I come back? Can I come back? It's like meditation. Can I come back? What am I noticing? Oh my gosh, I'm suddenly feeling all this warmth underneath my hand when I'm holding their forearm. Oh, that vasodilation is an energy release. Oh my gosh, they're letting go of something. And just being with that. And you don't have to verbalize, hey, what are you letting go of right now? I feel you're letting go of something. It's not about that, but it's noticing that moment to moment awareness, that high definition awareness. I think John Kabat-Zinn's work on mindfulness-based stress reduction and insight embodied meditation practices is also a good place to start learning this fine-grained attunement. And then it's like, I felt the subtle retreat of somebody's body. That is a nonverbal no. But because you're attuned, and then as you come off slowly, right? So you're not transmitting, oh
Jerking
my
and
gosh, I'm so sorry. I'm freaking out, because then they'll freak out. That you come and almost feeling, if you could feel the electromagnetic field coming off their body, what would it feel like? and
Mm.
slowly raise up through that. One of the things that I also do to communicate safety and attunement is when somebody is on my table, I actually have them take some deep breaths, noticing their breath, noticing their body movement. And then I say, to take a really deep breath, let it go. And on the next inhale, your body will rise to meet my hands. So their body is coming toward me rather than me coming into the body, which is another way to talk about attunement, right? It's not something I'm doing to you, it's something that we're co-creating together. And it's so weird that the more I'm into the meditation experience of what's in my body, and my style is very much like team Tai Chi. So I'm doing yoga in my lower body, Tai Chi in my upper body while I'm delivering the massage. The more I'm into that, the more I'm hearing the music, the more tuned in I am to my immediate experience, the better the massage seems to go for my clients. Even when I'm like, okay, something's coming up for me and it's my stuff. Okay, acknowledge it, put that in my back pocket, come back to what I'm feeling underneath my fingers. In Kiatsu, Court Wing, who's a practitioner that I just absolutely adore, he has this phrase from Kiatsu where it's putting the mind in your fingertips. But that also means becoming safe in our own bodies as practitioners.
Mm. The sea otter was a really beautiful. Like I mean, for listeners, I had my eyes closed and could feel and become the baby sea otter. It was beautiful. It was really cool. And I really thought, I've been on the table so many times as a runner, but I've never really looked at it through your lens. So this was so incredibly insightful to think about it from your perspective.
Sure. Well, thank
And
you.
yeah, and I feel like a lot of us, I think a lot of people when they hop on the table, like they're not really thinking through the other side of you and the things that you're feeling and that you're bringing to the table. So just the little things of feeling the forearm and the heat and the attunement, I think it makes me think differently about this. And honestly, the next time that I lay on a massage table, I think I'll think about it completely different.
Well, I would invite you to take it as your own meditation of what am I noticing? What am I noticing? What am I noticing? And, one of the things that I do like about my style is I'm highly trained in body reading, functional anatomy, structural integration techniques, which do have a relationship to the human potential movement. Not a lot of people know that the person who moved into Ida Rolf's office after she left Eslon was Stan Groff. But it's true, but we don't talk about it, but it's true. So we just lost my train of thought. It just really went out there.
Yeah.
Um, I was gonna say, so one of the things that I like to do is to sneak in some of those sports techniques or some of those structural integration techniques or shiatsu or a little bit of traditional Chinese medicine or a little bit of soplas and chuplas, like all of these little things into a highly integrated and integrating container so that you can drop in, but then at the end, I can give you the same information that sports massage therapist might be interested in communicating to you about, like, shins, here we go, or, runners,
Yeah.
runner's spot, IT band, even, that back pain that's not quite your lower back, but not quite your middle back is like, as runners, when the diaphragm becomes, especially distance runners, like, okay, I can just be with you and be with how you're breathing and your diaphragm in the session, and I can tell you about it later.
Well, that's so cool.
Yeah,
Wow.
that's what I try
So
to do.
So talk to me about the learning side of this because your website has like so many cool modules on it. Like, I mean, and I think that's one of the things that really intrigued me about you is that you have this awesome practicality practice side of what you do. You're like so informed, so academic. I mean, just on a one-on-one, you're just a great person to be able to know and to talk to, but you have this learning side of unwind that's really, I mean, there's a lot of really great content out there. So talk to me about that.
Yeah. Well, I think, I have a background as a Master of Science in Education. I used to build really important flagship programs for large companies as an employee. And, I also used to teach business school and cooperative design. And I studied for many years with Howard Rheingold on and off complex adaptive systems. And so I do have, I'm not the average bear when it comes to
It all
what
kind of
I'm
makes
bringing to
sense
the table.
now. Yeah.
Yeah. And so some of the courses, I think, I mentioned earlier that the first course on entheogens and psychedelics for massage therapists, which is an ethics course. I'm not teaching you how to work with psychedelics. I'm teaching you about people want to have this conversation. They come to us because we have this expansive appointment that's very difficult to get with their primary care physician, or they don't want to talk to their primary care physician about psilocybin or ayahuasca. Okay, this person's in your office. What do you do with that so that you're protecting your own practice as well as engaging in a really strong harm reduction practice? So there are things like that. But I also have, the Touch with Substance conference, over a dozen presenters talking about high touch containers and altered states of consciousness, ethics, case studies, which I think is remarkable. We have a case study from Fort Wing where his client, Lynn, was very gracious to allow us to show a video of her session. And this is somebody, complex regional pain syndrome is incredibly difficult to treat. And not only was she having the pain reduction, she was able to move her foot for the first time in 9 years voluntarily. And we get to see that video. So I really have tried to build something where there's collaboration. I have courses coming up on dismembering and remembering, which is using the story of Isis and Osiris as this idea of, in post-psychedelic integration massage, when you have somebody who's been on the Ouroboros of dying over and over and over again, and then somehow they're supposed to come back to this meat suit, and like what does it even mean to have a body anymore? Like, massage actually can really help with that. How do we bring in that person? How do we hold that space? And put some poetry on it, put some mythos on it, put some mystery on it, because it is a really sacred holding. It's not just about putting hands on. And then I have a course coming up I'm really excited about. I am a filmmaker. I've written feature-length screenplays. And one of the things that I've always been interested in is the story of Dune. Now, the first book of Dune is built, it's kind of a fake out on Joseph Campbell's hero's journey. And this is a story that we use in psychedelic narrative all the time because we're so hyper-focused on individual culture.
Mm.
And that's not how these substances have taught us that they want to interact with us over
Right.
the centuries and millennia. So what are those other models? And there's this book I read for a screenplay I wrote. And the book is called The Heroine with 1,001 Faces by Maria Tatter. And she talks about doing Joseph Campbell's study that he did to come up with the hero's journey, but looking at women's stories and really finding that the heroine's journey, very different to a sort of a Freudian sense of losing femininity, coming back to femininity, is really about reweaving the tattered edges of the social fabric. And so if we bring that into community, sitting in community with or without substance, what can the heroine's journey teach us about what this means to be on the ride together with other people, and the different applications that we could be coming back to using these substances for, even, conflict resolution, um, community engagement, and what do we do next? Like, kinds of different things. So I like kind of playing with those edges. And I have, in my neurodiverse self, I think I was born with two spring-loaded middle fingers. I can be very punk rock. And it's my way of being like punk rock is to be like, no, 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 we'll talk about the heroine's journey and that kind of a thing. So I try to make it fun. I also just launched a pilot course on post-psychedelic integration massage, and we are talking about ethics, the ethics of tipping when somebody is in a critical window period. Like, no, like you can have that conversation with me. But we're also talking about like, why do people come for post-psychedelic integration? And then having my background in business, having some coaching around how do you integrate this as an offer? What are some of the risks of even putting the P word on your website? How do you deal with it if the cops start, like massage therapists are used to cops calling us trying to pretend that they're soliciting illegal services. But then you get this whole other call, and
Wow.
you can
I
always
guess I
tell,
hadn't I guess I hadn't thought of that. So yeah. Okay.
yeah, you can always tell it's them because they call during business hours. But yeah, it is really fun to be able to have those conversations. And it's also, it's really challenging a lot of our edges. And I had a journey recently, and my person who was sitting for me said, wow, it really seems like you're stepping into life's work territory. And I'm thinking like, oh my God, I'm 44. I could literally be having this conversation for the next 30 years on repeat. I don't know if I want to do that. But then the clients come in, the students come in. Most of my courses are designed with a lot of co-learning, a little bit of my Howard Rheingold legacy. And I don't do pedagogy, I do andragogy, pedagogy. So being able to have this collection of individuals like just contributing to the richness of the learning container is like, that is my jam. I loved teaching design thinking because I never knew what we were going to learn at the end of a session. I never knew. Even if the structure, the really simple structure remained the same, the outcomes were always radically different and interesting. And so I try to create courses around that kind of thinking.
And how do we find those? So your website?
Yeah, my website is unwindlearning.com.
And I think you can actually link from there from your website, right? From Unwind Oakland.
Yeah,
Yeah.
it's also cross-linked with Unwind Oakland.
Yeah, there were a lot of really interesting courses. I saw that when I was there, and then because we talked the last couple weeks ago, I have some access to it. They're really cool. Like they're very very interesting. So
Yeah, I love when people who are recent graduates of psychedelic certificate programs that shall remain unnamed get on there and they're like, "This is the stuff that we didn't learn. This is the stuff."
yes,
They just kind of chucked something at us that said like, very little about touch and honestly very little about harm reduction. And then they're like, I can actually get some depth with this conversation.
and there's a lot of those out there. I feel like there's more and more certificate programs that are popping up for facilitators. And I think that's one of the things that I thought was really unique about the things that you're right. I mean, you actually have meat in a lot of the things that we did not get in a lot of those 50, 100, 150-hour things. Like you don't think about that, about the other side of that. So it's really,
And my goal is, you know, I'm gonna be taking those requirements from the different licensure programs and seeing like how does that map to my content. Can we do it all? I think we could do it all. I think we could. I think it would be fine if we did. But then that also is challenging because people come in and it's like, well, but in my license says that I can only do this and this. And it's like, yeah, and you're agreeing to abide by that license and that's your choice. And, the rules are pretty arbitrary, even if they are well-meaning. They're not informed by high touch practitioners. There's this thing in my classes, one of the ones that I do. I don't know if you're familiar with the yoga pose, Happy Baby.
yeah.
There's a way to do Happy Baby in an assisted stretching mode. So basically, I'm helping somebody get into Happy Baby, and I can be touching them within a compliant way within those licensure programs and actually work on opening up some lower back. And that can be great for people who feel like they're carrying the weight of the world or they've gone through a lot of muscle contractures and their low back is feeling sore and they're just kind of, you know, and I can do that stretch. But when I do that stretch, if you look at it as a third party observer, it's like, that actually looks kind of risque. Like it doesn't, like it's not, I'm not somebody who wears my genitalia on the outside.
Uh,
But if I was, that would be a risky move, but it's compliant. On the other hand, I could give you a really, really hot hand massage. I don't do that in my office, but I could, or you could perceive it that way and we'd still be in compliance, but it would be a problem. So it is very nuanced conversation. And I want to give a lot of credit to the people, who do the high touch work, who are working on chronic pain conditions as an example, and our clients who are showing up to these rules making hearings and really trying to make a difference in how these rules are written. And yet the cultural depth and the taboo and the shadow that we have around touch is so incredibly deep that it feels insurmountable. And it's like, I'm just trying to work on it, like one interaction at a time. And I don't know if I'm going to be able to pull it off for 30 years, but I'm giving it a shot right now. And we'll see how, things look tomorrow and tomorrow and tomorrow.
and I feel like that's the beautiful part of this and the work that we're all doing. So I get the opportunity, 'cause I'm building a new brand and all the fun stuff of cold calling ketamine clinics. Now that in itself, some people would say scary. I love cold calling. I think it's just because I love people. And I had the opportunity to meet with a clinic the other day, and I walked in, had no idea who they were. And I happened to meet the owner, and just standing at the front desk, just connecting, I felt like I could have hugged her on my way out. And I feel like we were there because we had shared stories of for both of us. I mean, again, random strangers talking about our abuse, talking about our healing, talking about what we both wanted for the industry. And at the same time, I also felt the challenges that she had being an island, being part of an institutional kind of a medical thing where you're not quite clinical institutional, you're not quite, this woo woo thing over on the other side of this. You're trying to figure it out. So I applaud the work that you're doing every day, whether that be for the next 33 years or whether that be, the next day. Because I walked out of there and I remember coming home and just crying this morning, just like feeling all of that because this is a challenging industry for all of us who do this, who really care about humanity. So, again,
It
Suz,
is.
I
It
applaud you.
is. And I want to shout out the ketamine providers who are really providing a lot of care and a lot of warmth and connection and presence throughout the entire process with their client patients. I know one of the things that we talked about was have this phrase, I was a patient at a psychedelic slaughterhouse. And what I do is so in opposition to how the design is going for the FDA approved treatments. And I've been to two of those treatment centers. And the way that things are being scaled um, is, one MD and multiple people who are delegated to who are not licensed professionals. Sometimes they're nursing assistants or receptionists who are delegated blood pressure duties. And you get a call button and you might get somebody to unlock a bathroom door. And that's the level of care that you get in a room where you're divided by curtains and there's maybe 7 or 8 people at different parts of their journey at the same time in there with you. You don't know them. There's no therapeutic alliance. There's nobody present. You're stuck in the ketamine chair, which I have already said I do not love. So as we're seeing this roll out, it is infuriating because that time is getting billed at hundreds and hundreds of dollars per hour per person in that high scale environment. And what I am doing is so much less expensive and so much higher care. And that is really hard. It is really hard to see that. It's also really hard to see people see what I do, and then maybe they're not in my location or they don't want to jump through my hoops and they just want to run out and do a ketamine massage. And there's not risk reduction or harm reduction information available. And so what I'm doing when I'm writing my book is really trying to put that resource out there, because I know from, people like Cluster Busters and, the recent book, Psychedelic Outlaws, like Kempner and other studies that have been done, is that, people will look for best practices. They will look at studies. So they will try to making their own decisions, which I cannot make for them. Um, they'll try to find solutions. And I'm kind of one of these people. Like, was I going to wait for the FDA when I was suffering and I couldn't live my life in the present moment? Absolutely not.
Right.
No, that's not what no. So I know that if I put something out there that's about harm reduction and risk reduction within the space of high touch containers, as I work with them with ketamine, that it's going to support a lot of people having the resources that they need to go with a little bit of experienced wisdom, I hope, but ultimately make their own decisions about what's right for them. But yeah, it's a hugely tough space to be in. And then you start trying to get into professional liability insurance. It just, and then while all of that stuff is going on, then your booking engine catches on fire and you have to put out that one. It is really, really difficult. And I want to respect that ketamine providers who have created this bridge. I mean, every bit of that is hard won. Every stick, every tie in that bridge is hard won. And I'm in the process of building the bridge. And I'm just like, yeah, I understand now why you're like, don't mess with the bridge.
Yeah.
Don't touch anything, literally, metaphorically, don't touch anything.
And as you're saying it too, I mean, I've heard a term because I was talking to another clinic, and I heard a term, and I share this all the time. And I think I did a blog on LinkedIn: street 'em and treat 'em, or treat 'em and street 'em. That's all they do. So we
Yeah.
just treat 'em and street 'em, and on to the next one. And I'm like, wait a minute, what is that? They're like, we just throw the IV, let them go. It's just kind of like,
It
wait, what?
represents a profound misunderstanding of the
Yeah.
mechanisms of action. And I think that is, it is a Cartesian, reductionist, siloed kind of hangover. And it is really, really hard to be a patient of somebody with that perspective, knowing what I know. But one of the things that I think we can talk about is that these substances that are opening up the critical learning window periods, which is beyond neuroplasticity, it really is a specific developmental state. And again, here I'll cite my master's of science in education, but it's a specific developmental state. So if we take somebody back to a developmental state where their system is in a similar place to where they might have been when they were very young, and they were learning about self and other and building body schema and exploring boundaries and what does safety and touch and connection really feel like. And then we ditch them in a ketamine chair and close the door. We're recreating a trauma of omission.
Yeah.
For somebody who has experienced neglect, you're recreating neglect. And so that is if this is a learning opportunity, what is the learning that we are installing within that space? And if we're teaching people to be more individual, more alone, okay, there might be a need to start off with that internal relational work. I certainly had to do my own, but at some point it was like, I'm ready to have relational work and heal that aspect of my capacity to exist in this body and on this planet. And so if we're not offering relational learning, then what are we doing? And it is really, really tough because there's this idea of who is qualified? And no, I'm not qualified to do an IM bolus. I don't do it. I don't offer it. And it would be locally contraindicated for massage anyway. But, I've had a fair amount of training at this point on holding space in psychedelic containers. And I've had more journeys than most ketamine providers that I know. and I can tell the difference. So
I
there's
always
this,
wondered that too. Like when I
like,
meet with clinics, I'm how many times have you? Yeah. So, and
yeah,
some of them never. They just knew how to administer, and that's what they do.
yeah, and there's some dose dependent assumptions.
Hmm.
People apply what happens with anesthetic doses or near anesthetic doses of ketamine to low dose ketamine, both in terms of protocols and assumptions about the experience that are paradoxical. At low dose, ketamine as a general amplifier can increase your sense of embodiment. I think all of these medicines have things they love to do. Psilocybin mushrooms, they're like, you forgot that you are nature. Welcome home. And MDMA is dancing in and says, you forgot that you are love.
Yeah.
Welcome home. Ayahuasca, you forgot that you are a child of creation. Welcome home. And ketamine at these low doses says, you forgot that you are your body. You forgot that you are your body. Or maybe you never learned that. And welcome home. Like, this is what it means to be comfortable in my own skin. How do I recreate this between now and my next ketamine session? Because I want to live in this level of comfort in my own body. Like, ketamine gives that gift, and that is not dissociative. It's profoundly reassociative.
Very. Yeah. How? Like I welcome home.
Welcome home.
And I feel
Welcome
like
home.
that's what we all want. We all want to just be welcomed home.
Yeah. And I have a thing that I like to do in closing, and it's a little bit of energy hygiene that I learned from Catherine Revoix over at Richer Living, who's been my teacher for many years. But that when we have a close, we say, I take for me what is mine, and I leave for you what is yours. Knowing that if you need support with what is yours, you are absolutely resourced to reach out for it.
Beautifully said. Suz, thank you so much for joining me on this episode and for welcoming us home.
One person at a time, and the first person is me.
I mean, this has given me thoughts of even having another show where we just talk about what questions should we even be asking as we're walking into a clinic. So we'll definitely have this conversation. But again,
We'll
thank you
continue.
so much. This is Alan Wiederhold. This is Numa.